The SNP's plans for a national care service have already wasted £28 million of taxpayers' money. 4 parliamentary committees have warned about its flaws. NHS bosses have serious concerns. Scotland's council leaders and unions have pooled their support. So why is the First Minister pushing ahead with a plan that nobody seems to want?
First Minister.
Before I answer the substance of Russell Findlay's question, may I welcome him to his post as leader of the Scottish Conservative and Unionist Party, and look forward to these exchanges, which will take their course over the next few weeks, months and years. On the question of the National Care Service, the National Care Service is a product of consultation and dialogue with members of the public, led by the Findlay Review. And the Findlay Review concluded that there was such variation in the quality of social care and the effectiveness of social care around the country that there was an argument and a necessity for there to be a national care service to make sure that wherever individuals are in the social care sector in the country, they are able to receive the highest quality of support. That is the foundation behind the National Care Service, and it's on that basis that the Government will pursue the proposition that we've put forward to Parliament.
Russell Findlay.
I thank the First Minister for his kind words, and I look forward to our exchanges. I've counted 60 until election day. But what I really hope for from the First Minister is some answers. 1 in 5 care homes have closed over the past decade, and the NHS is paying the price, with almost 2,000 people trapped in hospitals, which is the highest on record. First Minister, Scotland's care sector is collapsing today. People need action today. Every penny should be spent helping them today, not wasting years on yet another SNP pet project that is doomed to fail. So why can't the First Minister see that?
First Minister.
It's for many of the reasons that Mr Findlay puts to me that I support a National Care Service, because I am very, very concerned about the level of delayed discharge in our hospitals today. And it's been the focus of significant attention from me as First Minister and the Health Secretary and his ministerial team and those acting on our behalf. Let me just give Mr Findlay an illustration of why this is a problem in the country. Apart from the fact there are nearly 2,000 people who are delayed in leaving hospital at this present moment, and we've been putting in sustained efforts, and I think the situation would have been significantly worse had we not done so. But today, per 100,000 of population in each local authority area in the country, the number of delayed discharges ranges from 9.3 in one local authority area to 108 in another, 10 times the difference. So if one local authority area can secure a delayed discharge level of 9.3 per 100,000 of the population, I ask myself, why is there a position which is 10 times worse at the other end of the spectrum? That is unfair in this country. It needs to be addressed, and that's what a National Care Service will deliver.
Russell Findlay.
The First Minister's own figures reveal that this is a today problem, and it's classic SNP, wasting time and money, neglecting what people really need. Government ministers yet again grabbing power from local communities. The National Care Service will cost billions of pounds, and that's just to set up. So how will another expensive, bloated and wasteful quango help anyone?
First Minister.
Well, one of the factors that Mr Findlay will be calculating in his cost assessment that he's just put on the record today is the fact that as part of this exercise we intend to increase the pay and remuneration for social care workers around the country. And no wonder Mr Findlay objects to that, because the Conservatives have objected to every attempt on our part to improve pay for social care workers the length and breadth of the country. So I can assure Mr Findlay that at this present moment there is significant pressure being applied to improve the delayed discharge position in local authority areas where it is poor, and we maintain that pressure on a constant basis. It occupies a huge amount of my attention and that of the Health Secretary as First Minister. Some areas are improving, but not nearly fast enough. So if we have a situation where in one local authority area it is possible for there to be only 9.3 members of the public in delayed discharge per 100,000, how is it justifiable for there to be 10 times that amount in any other part of the country? That's why we need a national care service.
Russell Findlay.
This really does sum up what's wrong with politics in Scotland. Plans for a national care service that are costing a fortune but not caring for anyone, just like the ferries that don't carry passengers and prisoners that free criminals early. This government needs a reality check. It's become disconnected from the people it's supposed to represent, like the thousands who are in need of care today. Yes. Surely it's basic common sense to ditch the SNP's National Care Service plan and just put the money directly into frontline care.
First Minister.
This government is investing in our social care system and investing in the provision of care services throughout this country in a more significant way than is provided for by the financial allocations made to Scotland by the United Kingdom Government. Now, Mr Findlay, of course, was a supporter of Liz Truss. We can...
Carry on, First Minister. Members.
Don't like it.
The Conservatives obviously don't like being reminded that Mr Findlay... The Conservatives...
We will hear the First Minister. Many members wish to put questions today. I'd like us to continue. First Minister.
The Conservatives obviously don't like hearing that Mr Findlay was a supporter of Liz Truss, whose economic and fiscal policies have undermined the public finances of Scotland. That is the reality that I'm going to point out to Mr Findlay. And what this government has done is it's taken the hard decisions to invest more in our public services, more in our health and social care services than would have been the case if we had followed the United Kingdom Government's budget allocations to Scotland. £1.5 billion more invested in our public services. So if Mr Findlay wants a lesson in reality, I will tell him that I will not follow the discredited and failed policies of the Conservative Party. We will make our choices here in Scotland to invest in our public services and to protect the people of our country.